All right, so it's good to be here. Actually, good evening, everyone. I'm Janetta Dewey. I'm actually right here today to representing Family Wellness Therapy Center. It's actually a psychological service located at Lekki, Lagos, but at the same time, we offer services worldwide. So I will just go straight at it. So today, I would like us to talk about depression. So I'm going to be using a particular approach, which means I'll be asking you just let me know. Feel free to share your opinion about what you know about depression, and I'll be asking you. So, since you are the one that is here right now, I don't know if you want to go. Mr. Sanusi, do you want to tell us what you know about depression?
Thank you for the opportunity to share my experience and all that. Well, I'm in the
Okay.
kitchen. I'm trying to cook something I will eat. So I'm just here to listen to the enlightenment you
Okay.
have for us. So I don't know if there's any specific thing you want me to say about depression or something.
Okay. I just wanted to know, yeah, what your view is all about when it comes to depression. Like, let's just talk. What comes to your mind when you hear depression? I mean,
Oh, well, I can just say depression is a mental illness characterized by some behaviors like withdrawal from the environment, feeling of hopelessness, and a lot of things. I've experienced depression several times, you know.
okay.
So, and I tried my best to come out of it. But some of those things causing depression for me, I'm still within the cycle. So, it's difficult. It's not like it's difficult, but the reality of life and everything makes it difficult to fully come out of this condition. That's my perspective and my perception. I have another way of looking at it. So thank you.
Yeah, thank you so much. I like how you took it to the angle of your own personal experience. And just like you said, it's actually not easy to come out of, but I'm glad that you can share it. So thank you. So I'll just jump straight at it. So most times when people hear depression, some people mention, so depression is not just the typical sadness, maybe something didn't go in your favor and you're sad about it, or maybe you are going through some financial crisis. Yes, it can be really sad, but at what point do we call it depression? So I will just start at it. So I think the first thing I would like to do is to define it from a psychological perspective, so from there we can now break it down. So it's actually a mood disorder. So there are diverse mood disorders, but depression is one of the most common one. So it's a mood disorder that is characterized by persistent sadness and persistent sadness, loss of interest in activities that you formerly enjoy or used to enjoy. And there can also be physical or cognitive changes that can cause severe impairment in daily life. Now, all these things I mentioned, there are also some criteria that needs to be met before they can diagnose such. At least it needs to be like for 2 weeks. This you need to have some of the symptoms like consistently for at least 2 weeks every day. And at the same time, you need to be able to tick certain numbers before we cannot call it okay depression. And that's why assessment is very important. But let's not go into it here. All right. So just like the one I mentioned right now, so I'm just going to be mentioning some other symptoms that you can notice when it comes to depression. So the depressed mode. So the person normally used to be like, oh, someone that is full of joy, and suddenly just realize that they are going silent. They don't want to talk about things and activities. Even if they are trying to smile, you could tell that they are just faking the smile. Like it's no longer getting in. Like it's no longer fun for them. Then another thing could also come from sleep difficulties. So is either they sleep a lot, like more than usual, or they sleep less, more than usual. So there can be sleep difficulties. That's also another symptom. Then another one is the fatigue, whereby they are always tired. You know, most times people believe that when you are tired, you sleep, you rest properly, and then the following day you wake up to the next activity, and then you are good to go. But in a depression, in a depressed situation, is actually a different thing, whereby the individual can even sleep longer and yet we wake up feeling so tired. All right. So another thing can also be significant weight change or weight loss. You know, so for some people, they hit a lot when they are very sad. So I would say depression because I'm not sure of all that things. Like remember that there are criteria that needs to be met. So in situation of depression, the individual can also be eating a lot and may have more weight gain, even eating sufficient as well. Then in severe cases, they can also be recurring thought of death. So, or maybe thinking about death or even actively trying to take their life. So that's also another one. Then concentration can also be reduced. So when we're talking about that concentration being reduced, um, so most people are used to when they hear depression, they always think that okay, it means the person will have low energy. Yes, low energy is one of it, but sometimes it can also mean agitation, which looks like high energy, but this time around is actually restlessness. You know, they are just pacing here and there, and they are very fast with it, that kind of a thing. So it can also be a symptom of depression and every other thing that can come with it. Yeah. So if we are to be talking about the science, science varies for everyone. And also the isolation and withdrawal is also another thing that you can also use. That is also some of the signs. Um, so what are people actually saying? I know that many people when we talk about depression, some people even say, oh, females are more they get more depressed. And some people will say, okay, it's actually female. Let's not go into that. You get, I feel like that debate is not why we are here today. But one thing is, some people can express themselves better in situation that is causing them distress, while some other persons may not be able to verbalize it. So that means that your guy friend that is doing hard guy may actually need you to check up on them. And also that lady that is actually very vocal and don't think because of that, don't think that they can be depressed as well. So it means it's a two-way situation. Yeah. So now I think a lot of people always ask me, okay, so what causes depression? What can make someone depressed, things like that. Yes, so there are many things that can cause depression apart from so the first one I think I would like to mention hereditary. So most times we always talk about the social situation surrounding us. Yes, those things can also make the depression, like can also be a risk factor to it. Yeah. But let's talk about hereditary. So let's say you have one of your parents or sibling or family member have depression. The person may also be susceptible to having depression as well, same as most of the mental health concerns as well. Then also we can also talk about the psychological factor, of course. Situation where someone already has low self-esteem, that one can also make them susceptible to it because, and also situation where the person already has okay, so some biological factor as well, such like maybe the person has accident or surgery or something related to their biology. Also, I think thyroid, maybe there's something related to thyroid gland, just something inside their body can also make them have some of this depressed mode, basically. And so what that means is your physical health has a way of like interacting with your psychological health. So it's like both of them are interwoven. That's why they always say take control of your diet, take control of your health, because at the end of the day, the physical health also have a way of affecting your psychological health. So meanwhile, so enough of us going into the should I say the technical aspect, because we've been talking about what is depression, types of depression, things like that. So I want us to like go into the more real aspect of it. Like, so what can you do? I mean, these days you will hear, oh, this person is depressed, and at the end of the day, you find out that they don't know what to do. Do you get? And so that's why I felt like, oh, this topic is quite crucial for us to like dissect what depression is all about and how you yourself can help yourself and at the same time seek for the right support and also give support to anybody that you know. So the first thing I want us to go into is something called core belief. Yes, so our core belief, I want us to look at it in form of eyeglass. You know, so when we go to a party, for instance, and everyone is asked to put on eyeglass when coming, everybody is going to come with different shade. And that shade is going to affect how they see the party. Personally, I like to use a red shade. Just have a way of giving as if the room is brightly lit, you know. And some people will go for the darker shade, you know. I just want to be cool. So that's the same way that core belief also works. Like our core belief is like our eyeglass, is the one that help us to interpret the world. So at the end of the day, it means the shade you put on will determine what you eventually see. Can you still hear me, please? Hello.
Yes, you can
Okay, I
hear you
just,
now.
oh,
Can you hear
thank
me?
you. All right, thank you. So yes, so and the reason why this core belief is very important for us to discuss is because it's one of the common thing when we see an individual that is depressed because the way you interpret things goes a long way to talk about how you are going to feel at the end of the day. Okay, and mind you, no two persons have the same core belief. Do you get? So that's one thing I want you to know. And what that means is at the end of the day, at the end of this session, if anything, I want you to reflect more on what shade of glass do you take to the party called life, basically. Like what kind of shade did you take along? So so speaking of that, so which means our interpretation of the world depends so much on how we are going to live in that same world. And that takes me to sometimes the glass that we are using may be faulty. Yeah, I'll say it again. So sometimes the glass that we are using to view that world can be faulty. That shade that you have sometimes can be dirty. Sometimes there can be some marks on those glasses. Sometimes maybe it's not even your own shade, maybe it's borrowed, who knows? So I mean, those are like things I want us to talk about more, which take me back to cognitive distortions, which means just like the name, forget the big grammar. It just means you remember that cognitive means your thought process, right? How you think, like what is going on in your brain is like your thought. So that is cognition. And now distortion, it means it has changed. It means it's slightly different from reality. And what that means is when we find ourselves having this cognitive distortion, sometimes we are not even aware. We are not aware because you can only justify what you see from your own perspective. If someone else call your attention to it that, oh, this thing is actually, you're not saying it correctly. From my own shade, this is how I'm saying it. But from your own shade, it's like, oh, this is it. So sometimes they can be very negative. So one of the common things when it comes to an individual that is depressed is you notice negative thought pattern. So I am not worthy. Something like um, something like I am not worthy. Something like oh, I feel guilty that I can't change anything. There's nothing better. There's no future. So statements like that, if you look at it very well, you will realize how much distorted it is actually from the reality of things. And yes, I'm not saying everything is positive. We have to be happy. In fact, if anything, I won't say I don't encourage just positive thinking. Instead, what I would say is I encourage every thought. Something can be positive and not helpful, and something can be negative and not helpful. Do you get? So just because it's positive does not make it helpful. For instance, if um if someone share a bad news to you, a good news, a great news, for instance, and or let's say a bad news, for instance, someone shares a bad news, and then your thought process is you picking out the positive in that situation. It may not be very helpful in that situation because now that person will feel dismissed, you see. So what I'm saying is some of these things that we like some of these eyeglass may actually not be the reality of situation. Like you feeling like, oh, I am not worthy of this love. You feeling like nobody cares for me. You feeling like everybody hates me, things like that. Or possibly you feeling like there's no way you can change your circumstances. So indirectly, it's now bringing this guilt. Like, I knew it's still going to come again and it will happen. Yes. So, having pointed that out, now I still want to ask questions. I think now we have more people on the call and I want to ask question. I don't know if someone wants to tell me if there's any other cognitive distortion that they think also happen in depressed situation, like depressed with a depressed individual, apart from the one I've listed. Can anyone also help out? You can just raise your hand if you can. Anyone? Okay, I think someone. Or you can just drop it in the chat. Just drop it in the chat. Also, any of your questions, you can start dropping them in the chat so that at the end of the day, we can just go straight at it the moment I'm done. All right. It seems we don't, nobody's talking, and I don't want to call names because this is recorded. All right. So having said that, remember that I mentioned that there are some core beliefs, and those are like the way we interpret the world. And sometimes what we feel sometimes may is valid that we feel that way, but it is not fact. Do you get? And at the same time, the cognitive distortion also exists, whereby you start thinking that, oh, everybody hates me, the world is bad. But I mean, if do you think the world is actually totally bad? Like if we look critically into it. Now, the question is when people who are depressed, sometimes they can't help themselves from looking at things from the negative angle. Do you get? Because of many reasons that I've mentioned earlier, like the biological reasons, who knows, the hereditary, the genetic, the biological, the psychological interpretation of things. So they can't help it. And in situation like that, so and that takes us back to how does that now lead to depression? I mean, so far I just mentioned, okay, there are negative thoughts, but how does that lead to depression? So this one I sometimes call it the depression loop. You get? So it's the depression loop. And when we talk about depression loop, it's like what keeps depression in circle for an individual. So for instance, I'm going to start with someone feeling like, okay, they are worthless, for instance. Or should I use worthless? Let's say, for instance, someone feeling guilt for not being able to like for not being able to get some things done that are vital to them. Do you get? But before then, let's start with the fact that we have a depressed individual, for instance, and just like we mentioned, the person may have low energy. So this person have low energy. Remember, so from that depression to low energy, and having low energy, this person have reduced activity. This person is not interacting with friends, is not interacting with people, withdrawal. You see, so from the low energy, because they have low energy, they are not interacting with their friends. And in between not interacting with their friends, at the same time, they're also neglecting their own responsibilities. Do you remember, like our responsibility to self, to people around us as well, and also to our loved ones. So they start neglecting these responsibilities. And after neglecting them, they started feeling, what do you think will happen next after neglecting them? They are going to start feeling guilty for neglecting it. Because now it's like, oh, I wish I'm a better friend. Oh, I wish I went out, but I don't have energy to go out. So now I won't go out. Now I won't show up for my friend. And now they are feeling guilty, which means more guilt, which also makes them feel like, oh, just like I said, just like I knew it, I'm going to disappoint them. Now it's going to push that disappointment more. And when they feel that guilt more, what do you think will also happen? They will get more depressed. You see, so it's just a circle. And that circle, the only way the circle can break is if they can go against it. But I will tell you how we can do that. Do you get? So yeah, so it's just a circle. Then another one could also be another example that maybe someone should help me out. Do you want to drop like a scenario so that we can use this loop to explain how that can come into being? Anyone? It's like everybody just wants to listen today. Yeah, we said we should talk. Let's talk, not let's listen. All right. So does anyone wants to give maybe more example or just a scenario and I can use the loop to explain it better? Okay. So maybe pending the time that we're going to have something like that. So I hope you all understood the description. You all understand this circle that I just explained. And so now that we've established that okay, there's something called this circle. And these circle are maintained mostly by our core belief or our cognitive distortions, basically. And remember, cognitive distortion is actually wild, and I don't want us to go into the academic one. Okay. So, and I don't want us to go into the academic angle because by the time I start listing them out, you will want to like know more and more and more, and we don't want to do that. Okay. So someone said in the group, it says, what should I do when I set goals and deadlines for my achievements, but I feel overwhelmed? Start believing I can't do it, and then begin to procrastinate due to past trauma. All right. So thank you for that question. We are going to take it at the end of the class. Do you get? But thank you for dropping that. So you can still keep dropping your questions so that at the end of the class we can take everything together. All right. So, but based on that question, let me take something, which is the fact that, okay, this person procrastinates. So, if I'm to use the loop to explain in line with depression, it's going to be in form of this person is depressed, this person has low energy, but there are some deadlines, some goals that is important to this person. So instead, this person did not do them because most of those goals require you having to bring yourself out or probably talk or probably apply. But because of the low energy, this person didn't apply. And now this person is going to end up having more guilt for not doing them. And then more guilt comes back to getting more depressed. So, yes, I'm glad that we could have an example to buttress this circle. So, having know now that we know about how this can come into being, the question now is, so what can I do? I mean, or what can I do to help someone that have depression? Okay, so the first thing, and I think is the most should I say most important aspect, is actually to reach out for help. Yes. So sometimes people say, oh, everybody will say reach out for help, but they don't know who exactly to reach out to. And hopefully, we are going to talk about who you can reach out to as well. But let's put it to one side that reach out for help. So sometimes we also wait for till something gets too serious, like get to the extreme, like critical level before we take action. Whenever you notice this symptom, it's the proper thing to do is actually to seek for help. Reach out to professionals, reach out to friends, reach out to family members, because you can't do this alone. All right. So then another thing you can do is like personally for yourself now is number one, you need to observe yourself. Yes, you need to like know yourself. Like, I think it should be know thyself. Yeah. So when you observe yourself very well, you will be ask yourself questions like, what eyeglass am I using right now that is shaping my life in the like in this loop that is taking me back to this loop? What particular eyeglass is it? So the moment you can figure out that, then it's easier to go from there. All right. So when you now find out, so for instance, let me give one core belief. For instance, one of the core belief that I mentioned earlier is everybody hates me. Good. So if you believe that everybody hates you, one of the things that is going to probably happen if we are to do it in form of the circle of loop, the loop of depression that I described is going to be in form of everybody hates me, and now you won't want to talk to anybody because what's the point of talking to people? Because after all, they all hate me. And now that you already feel like, oh, nobody, there's no point talking to them, that will even make you more withdrawn to yourself and more isolated. And the moment you are more withdrawn and more isolated, the more you are going to start finding evidence that prove that yes, everybody hates you. And the moment you find more evidence of everybody hates you, even if it is possible, even if that is not the intention, but because that is already your core belief, you are going to find evidence that supports that. And even if the person is trying to show support, it's going to look like, oh, they just want to do amebo to find out more. And even if you find out that, okay, the person is not even trying to do amebo, you may even think that okay, maybe the person just wants to like tell somebody or the person will tell everybody. It's just the change in thought process at the angle. So it's like, oh, everybody hates me, so nobody likes me eventually. There's no point conversing with anybody. Then you withdraw more to yourself, and then you see more evidence that supports what you already thought about. And next thing, you withdraw more, and now you will end up feeling isolated. And now that you feel isolated, it also confirms the fact that everybody hates you, which is like that circle back and forth. So if you can observe that circle, the next thing is actually to ask yourself, what evidence supports this? Like, look, yes, you may actually see evidence that seems to be correct, but at the same time, you may also see evidence that does not support it. So your ability to look at these two angles. So it's important that you look at this. Okay, it's important that you look at these two angles. So with that, you can be able to ask yourself, for instance, everybody hates me. You can ask yourself, okay, what are the evidence that showcase that everybody hates me? So the moment you can point them out, okay, I can look at me this morning. I greeted him, he did not answer. Okay. Now, that same evidence that you just pointed out, you can ask yourself, what other evidence can explain this? It is not just giving an excuse, it is actually you looking at the two sides of the story. So it could mean, do you think I can actually hear you? That's one. Do you think Akin, maybe, who knows, maybe Akin is actually not in the right frame, like waking up, maybe he has a lot that he himself is going through. That's also another thing. Okay, so that's for hacking. Okay, when I was talking to Ada, Ada and Aisha laugh. Are they really laughing? Okay, so for your own interpretation, it was like, oh, they are laughing at you. That is like evidence one, another evidence that supports the fact that, oh, everybody hates you. Then you can as well ask yourself, what other evidence opposes this? You get. So it could mean, what if it was like a coincidence? What if they actually found something else that is actually laughable at? What if Ada did something and Aisha decided to laugh and both of them laugh at it? They are just different things that a different explanation for that same thing that you are saying. You get. So with that, okay, please hold on. Okay, so if you're able to point out to those evidence, it becomes way easier to be able to spot out how to break the loop. Then the next thing is behavioral activation. And this behavioral activation, let's leave the grammar. Okay. So it just means you are going to do what you don't want to do, or maybe let me say the opposite of how you are feeling like it. For instance, if you don't have energy to do something, then maybe, and you know that if you don't do that thing, it will make you feel guilty for not doing it. Then instead, do that thing. Do you get just even if you are not feeling like it, just do it. For instance, you don't have energy to go out, you can just take a walk. It doesn't have to be like, oh, a big party. It can just be taking a walk. It can mean um, going to see a friend. It can, even if you don't trust, like, even if you don't want like a lot of people, just doing the opposite of the emotion that you're having in terms of that depressed mode. It can also help you. Then, especially for those that are working from home, I just need to mention, take that walk. Yeah, it's good for your health, both physical and psychological. Then another okay, so I mentioned behavioral activation. Sometimes you can also so if you want to show up for your friend, you can as well do it. Just try. Then another thing you can also do is to journal. Yeah, you need to write how you feel part time. So sometimes it's just we are so used to not being able to label our emotion. We just know that we don't feel like talking without knowing why. Like just label it. Why don't you feel like talking? And it's fine to not be able to put it into words in a just I'm fine, I'm not fine way. It can actually mean you writing a longer sentence trying to describe the emotion that you're currently feeling. So journal, write about anything. Write about, oh, if I feel like Akin hates me, and here are my reasons. And remember, while you are writing about that, you can as well try to find alternative explanation for that. So with that, you are letting your brain knows that okay, what are the evidence that supports this, and what are the evidence that oppose this. So also you can also try start experimenting. Just like you said, Akin did not greet you because Akin hates you. We support the fact that everybody hates you. Instead, you can try and say, okay, I'm going to walk up to Akin and ask Akin, oh, Akin, I greeted you this morning. You didn't answer. You see, I know that, oh, some of us would be like, oh, there's no point. I know Akin hates me already. Why not just experiment on that and ask Akin, okay, Akin, I greeted you this morning. You didn't respond. Then you'll be surprised that Akin may say, oh, I didn't hear that. Oh, I woke up this morning. My ears are like this. Oh, this. So with that, you can be able to see that, oh, maybe your own interpretation of it actually is not like that. Do you guys remember the negative thought process? So with that, you'll be able to confirm or disprove your claim. And then as well, if for instance, if you notice that okay, when you go out, that like when you go out, you don't want to go out because you feel like everybody is fake, something like that. You can actually try to talk to one or two person, bond with one or two person. Okay. So bond with one or two persons, and with that, you can be able to, okay, and with that, you can be able to see the other side of people to know that, oh, not like that. Because it's actually like to say everybody hates you is quite a general, like it's too generalized to be true. Because in this old world, there are even babies that don't know you, so things like that. So there's a question that says, what if Aki continues with that attitude? I like that question a lot. Yes, Aki continues that attitude, but remember that we are talking about the negative belief that says everybody hates me. Mind you, just because you greeted Akin, do you see now that it's true? Did not answer. Akin does not want to answer my greetings, which is also a what? A choice. So your ability to say, okay, maybe after you meet Akin, Akin was like, oh, I just want to talk to you, or I just want to greet you, and which is fine at the same time. But now taking it back to the alternative explanation and the fact that we having to look at it from the beginning, which is everybody hates me. So this is just Akin telling you that yes, I just want to talk to you. This is Akin out of everybody. So maybe you can as well go on when we are talking about the experimentation. Try it with Bimbo, try it with Shade, try it with Oba, try it with everybody. As much along the line, you will realize that maybe Akin is just the 1 out of 10, 1 out of 20, and then with that, you can be able to like see that, oh, maybe you are just you may not be correct when it comes to everybody hates me, because it's quite a general thing, and it can go on to shape our behavior at the end of the day. Then okay, I already mentioned journaling. Then deep breath. You see that deep breath is very important. Sometimes breathing has become so common that we actually don't know much about the impact of breathing. You know, it just as I'm talking, I've taken a lot of breath right now. But when it comes to deep breath, what it means is you having to ground yourself. So sometimes this thought process, in all sincerity, this thought process can come and it can be so much, and it will be weighing you down, because you can think about diverse scenarios that does not everything does not even go in the positive light. Like, oh my God, Akin hates me. Oh my God, Bola laugh at me with this. You get your thoughts, like all the things that have been buried in the past, you keep digging for evidence that support everything, and everything is like overwhelming, and you just want to like tell your brain to stop at once, but no, it's not stopping, and now you have to deal with it. So, one of the things is actually for you to take deep breath. You can as well journal them, then you can take deep breath. So for the deep breath, this is what I always suggest. You can breathe deeply, but rather than exhaling at once, you can take a pause in between. You get, so this pause you count 1, 2, 3, like before, like more of just 1, 2, 3, and then you breathe out. Then you quickly pause it, and then you count 1, 2, and then you breathe out. Then you now count one and breathe the whole thing out fully. I don't know if you can try that right now and look at how feasible that can be. While you are doing all that, you can also take notice the way your shoulders are going to relax, your belly are going to relax, your chest is going to relax more. So what you are doing is basically calling yourself back to being the present, because most of these worries comes from future or the past that you have no control over. So instead, when you stay in the present, it's quite difficult for you to worry. So you can do this deep breathing as much as possible. Like it's a grounding technique. You can do it as much as possible. So in a day. Then so someone dropped it that what if Aki is someone that you won't want to lose as a friend? So and that's also another thing. Another one of the things that make depression quite difficult sometimes is actually the fact that we want to have control. Yes, we want to have control, not just over our own life, but also control over other people's life. Do you get? So as much as you want something, if it involves someone else, your ability to know that this is like what is within your control and what is not within your control. So the moment you can spot what is not within your control, it becomes easier. Yes, you want Akin to be your friend, but at that point, do you have control over who becomes Akin's friend? No, and it takes two to tango when it comes to friendship. So your ability to let go sometimes also works. So that's for that. Then
Think
another
that
thing you can okay, another thing you can also consider is okay, I think I've mentioned all the things that you can do, and like I said, you need to reach out for help. So sometimes what we notice is, oh, our mood have changed. What we notice is this extreme sadness, and then we just quickly nail it, oh, depression. Meanwhile, remember I said depression is just one out of all the mood
out.
disorders. So
Voice it
which
down for me
means,
so that if you don't.
Mr. Demola, can you please mute yourself?
Hey,
It's okay.
sorry,
No,
please. I didn't know.
no, it's okay. It's okay. All right. So another thing that you can do is okay, I lost track of that. All right. Okay, yes. So I was talking about reaching out for help. So what that means is with professional help, you'll be able to you when you reach out for to professionals, they will be able to pinpoint if it is actually depression or it's something different, like totally different from depression. And sometimes it may even be something that is not even mood disorders. So with that, they know the best angle to come in and they know how, like with proper assessment, proper diagnosis, it's not just giving you advice or these are things you should be doing, don't do this. They will do proper assessment and with that you will be able to know the way forward. So so that's why professional help is very important. Some people will say, "Oh, I already have a friend that is advising me." Remember, therapy is not friend, is not advice. So you reaching out to a friend, yes, they will be there because social support is actually very important as well. It's not something I'm going to underestimate the impact. But at the same time, maybe reaching out for professional help will do better justice to what you need because friends will be there for you for social support and sometimes they may not get it. All right. So how can you help someone? Let's say you are not even the one that is going
Yes.
through this, but you want to be there for someone at the same time, you know. So number one thing is listening. Yeah. You know, it looks like listening is like one of the things that people do. It looks like it's supposed to be easy to listen, right? But no, most people they are like looking at, oh, how can I solve this? How can I solve this? So sometimes the best thing that you can give your friend is actually to listen to them, like listen and just be there for them, like staying present just for them. So it's something that you can also do. Then when you notice that this is getting extreme, especially in cases of suicidal ideation, having the thought process, even they may even already have some plans for it, please. The best thing you can do for your friend at that point is actually to seek for professional help for them. They may not like it. They may say, why will you tell somebody else? I just told you, please, it's the best thing you can do for them. All right. So another thing is you can as well support them. We know sometimes just like the way I said, financial constraints can also be an added factor, you know. Economic realities can be an added factor. So in the best way that you can show up for your friend, you can as well show up for them. But don't try to replace professional help. All right. So I think at this point, our time is fast spent. I intend to make it just 1 hour, and we can have 15 minutes for question and answers. So I'll pause here for now. So if you have any question, you can drop it in the box or you can unmute yourself. Okay. Please. I don't want to call your name. T83. You can please go on, unmute yourself and ask your question. Hello, T83. I think you are raising your hand, so you can just unmute yourself and ask your question. Okay, at this point, I guess I'll just call the name. So, Ngozi, do you want to go on? Just unmute yourself. Okay. So it's possible.
I'm
Okay.
not raising hand. Oh,
Oh, okay, okay. I'm so
so sorry
sorry.
about that. I'm not raising hand at all. No.
Oh, okay, okay. It's okay.
Thank
All
you.
right. So, yeah. So, do you have any question, anybody? Anyone? So yes, I'll just go to the question that was dropped earlier. So pending the time that people will be typing in their questions. So it says, what should I do when I set goals and deadlines for my achievements, but I feel overwhelmed, start believing I can't do it, and then begin to procrastinate due to past trauma? Number one thing is trauma is a broad thing, and I think if anything it's better when you reach out to professional help so that they can find the underlying thing and then they can start with you from there. However, based on the question that you asked, which is when you set goals and deadlines, so sometimes goals and deadlines sometimes can look so ambiguous, like it's quite big, especially for people that get overwhelmed easily. So you may try and break them down. You get make them look achievable. Like you can, for instance, maybe the goal is for you to, okay, the goal is for you to write 20 pages of a work, for instance, and the deadline is end of this month. So rather than look at it from, oh, I'm writing 20 pages and it's end of this month, you can as well break it down. Okay, first thing I need to do is to read about it. And after I'm done reading about it, the next thing I need to do is to maybe write a summary or maybe write, like, add anything together. And the next thing I need to do now is to write one page. So instead of having to look at it from that bigger angle, you can just break it down. Then at the same time, you talking about you feeling overwhelmed. Remember that there's also burnout. And yes, the burnout means sometimes it can mean you've probably stressed yourself for so long. Maybe you actually need rest. That's why I said it requires proper assessment so that you can be able to know which is which at the end of the day. Maybe it's the past trauma, or maybe it's burnout, or maybe it's depression that is leading to this. Then the believing, which is the I can't do it. You see, I can't do it itself is also a cognitive distortion, like a core belief that may actually like do change the trajectory of everything. So it's something that you can check out. You can ask yourself, what evidence do you have to make you think that you can't do it? And also, what evidence do you have that supports the fact that you can do it? Or you can start listing all your achievements out. Sometimes we underestimate all our strengths and then we overestimate our problems. So sometimes it can actually help you to maybe by listing out all the things that you've done in the past, and you'll be surprised actually that you've done way bigger things more than the current one that you're about to do. And so if you can do that bigger thing, is also a way to tell your brain that if I can do this bigger thing, it means this smaller thing should be something I should get done. So I think that core belief needs to be addressed so that you can find evidence that supports and opposes it. And then with that, you'll be able to break the loop. And like I said, you need to check out for the past trauma and so that you can be sure of what the proper diagnosis is so that you can know how best to come in and help. Yeah. I don't know, did I answer your question? Please, you can drop it in the chat or you can unmute yourself and let me know. Why is everyone quiet? Please, you can ask question. Okay, yes. So someone asked a question that at what point does feelings of being down graduate to full-blown depression? Okay, so I think I mentioned that in the beginning. Oh, okay, I'm glad that we've answered that question then. All right, so in the beginning, I mentioned that we need to firstly define what depression is because at this point it's becoming a common thing. Somebody will just be talking about how they went to a restaurant to eat and on getting there they serve them food that does not meet their expectation. And in between they'll just say, oh, so as I was eating the food, I was just depressed. And you're like, how did depression enter what you just said? You can just say if you were disappointed or you were not happy about it or you were sad or something. But instead they use depression to fit in. And that was why I defined depression, which is characterized by persistent sadness, loss of interest, physical and cognitive changes that causes severe impairment in daily life. Severe impairment. And there are criteria for this. So one of it is actually at least you must have this symptom for at least like every day for at least 2 weeks. Do you get? So once it can be every day, like you having some of these symptoms, or if not all, or most of the symptoms for 2 weeks or more, that shows that oh, it's getting there. But remember, yeah, the goal is not for you to diagnose yourself. The goal is for you to pick out things. The moment you notice something, don't keep it to yourself. Just like in physical health, when they will say when you notice one small lump, quickly take it to meet them so that they can check it for bigger problems that can come up. So with that, if you can notice, oh, this thing, and you know deep down that is causing great distress to you, then maybe you don't have to wait to be sure that it's full blown depression or not. So you can as well just reach out for help. then but according to the criteria, you have to have it almost every day for 2 weeks. Does that answer your question? Okay. Okay, great, great. However, one other thing I also want to mention is this, so far, all right, so far people are used to depression have to be like you don't want to go out, you are inside the house, you don't want to do anything. However, there's something, although it is not yet clinically diagnosed, but it's something that happened almost like it happened a lot and it's getting its own recognition, and that is functional depression, which means an individual can be going to work every day, can be doing all that is required of them, and yet be depressed. Most of these situations, you just notice that like the individual will start feeling numb to many situations, like everything will just be so numb. Like there's no point. They may have opinions like there's no point to life. What are we even doing here? And things like that, maybe suicidal ideation, things like that. But at the end of the day, these people may even be the best in their workspace. They may be the best when it comes to getting things done, but it doesn't stop the fact that they may actually be depressed at the end of the day. All right. So for now we don't have any question, and I will just use the opportunity to firstly I want to mention places where you can seek for help, like a place you can reach out for help. Um, we just like I said, I work with Family Wellness Therapy Center. So if you want to book an appointment or you want to see a therapist, a licensed therapist, you can as well just search for www.family wellness therapy center. And then we're also on Instagram, we're on TikTok, we're on every social media basically. So you can just reach out to us. Our DM is open, and at the same time, you can send a message to me. I can direct you on how you can get across to the organization. So, but I can also leave at the same time without recognizing my boss. Yeah, so my boss is currently here at the same time. So, Dr. Pamela Arnold Udoka. So, thank you so much for the opportunity and bringing me on board. So, thank you. Yes, ma. I don't know if you are still here.
I'm here. I was thinking I would just listen quietly and learn like others are learning. Well
Ah,
done.
bye. I'm learning from you, Esther.
That was a
All
good
right.
one. And thanks to everyone who joined the call. I hope you benefited like I did. Thank you so much. And follow her instructions and reach out to Family Wellness Therapy Center for more psychological help. Thank you very much. Well done, Janet.
Yes, ma'am. Thank you, ma'am. All right. So someone asked a question, and I don't want us to miss it before we wrap it up. It says, I have exam next week, and I'm not assimilating. Is there anything you can advise me to do? Because it's not unlike you. All right. So for this question, most times just this, for physical pain, one of the things that makes psychological pain, because if you notice everybody shouting mental health concern, mental health, and it's not because mental health is more important than physical health, and it's not vice versa as well, but it's because for physical health, like when you notice pain, you at least you know where the pain is, right? So, but for psychological help, sometimes they are too interwoven. So, one thing that you mentioned sometimes can just be a symptom of something else, and it can be some symptom of something small or something big. So, for instance, having to say, "Oh, you have an exam next year," but you're unable to assimilate. So, if you are to reach out for help, one of the things that will be asked is something like, "Since when? When did this start? And what happened before then? Before, like, what happened when you used to assimilate? What happened now? Things like that." So, there are so many things that is inside just this question. Do you get? So, instead, just for this night. I would say you can reach out to me just this night so that I can get to understand where you are coming from, and at the same time be able to give you one or two that could be able to help you. But I feel like if I'm to dissect this right now, there's a lot that comes with assimilation, and like there's a lot that comes with memory itself. So, and there's going to be a lot, and I don't want it to be like a typical thing that they just say, okay, carry the book, open this page, that's not going to be helpful. So instead, I don't know if you have my number, you can just reach out to me directly on WhatsApp. And this night, I'm going to schedule a few call with you. And then with that, you can be able to know where to come in. So yes, I've dropped my phone number there. So yeah, I think our time is fast spent. Is there any other question? I don't think we have. So if you have any question as well, you can drop it to the number and then we can address it. Just for tonight, please. Any other time, it means you want to contact Family Wellness Therapy Center. All right. So I want to appreciate every one of us that joined. I want to appreciate you all because I could tell that some of the people that joined are not even they are not people that really they are not I'm not saying they don't need it, but I'm saying they are probably rich they probably joined because they want to help someone else, and it means a whole lot actually being able to do things in order to be able to support another individual. So thank you. And also for people that are going through this, remember that you don't have to walk alone, we can walk with you. And so yeah, thank you so much for everyone that joined. And thank you once again, Family Wellness Therapy Center, for giving me the opportunity. So, good night, everyone.
Thank you.
You're
Good
welcome.
night. Thank you very much, Janet. Good night.
Yes, ma'am.
Good
God
night,
bless
everyone.
you. Thank you.
Good
Thank you for
night.
joining the call. Good night.
Thank you. Good night.
God bless you, ma. It was really helpful. Thank you so much.
You're welcome, ma'am. Thank you, ma'am.